name is Carson and I'm going to be your student nurse today. I'm going to wash my hands and provide us some privacy. So I'm going to introduce myself to the patient and get 3 patient identifiers: name, age, and date of birth. I'm going to verify our order and make sure this is a correct patient for catheterization. I'm going to gather my supplies and I'm going to first provide some pericare with a soap, wash rag, and some water, just to make sure the area is clean before we do any type of sterile work. I'm then going to grab my sterile kit. I'm going to open it, make sure that I only grab the 1-inch border. Okay. And then I'm going to put on my sterile gloves. And I would throw this away into my trash can. I am now going to grab our drape, and I would place the patient in a dorsal recumbent position and ask them to lift their buttocks. So I can just drop this here, try not to touch any of the inner areas. Make sure that this is underneath them. This drape would be used for a male patient, and we're not going to be using that at this time. So I'm then going to open up my kit a little bit more. Okay, so I'm going to grab the end of my catheter tubing and I'm going to place it in some lube, make sure it is lubricated before I put it into the patient. I'm just going to leave it on there for now. I'm going to grab my 10 to 12 milliliter syringe, and again, make sure this is full of fluid, and I would attach this to this section for later on in the procedure. I'm now going to grab some cleaning swabs for our patient. I'm going to move the labia with my non-dominant hand, and I'm going to place this in this hand, that way I have a better movement with this hand. I'm going to grab my first swab and I'm going to go straight down the middle. And then I'm going to try not to drag this over top of our sterile area, and I'm going to put this in our trash. I'm going to grab my second swab, and I'm going to go over this side. Again, no, drag it over and put it in our trash. I'm going to grab the last swab and do it over this side. Again, try not to drag it over the area and throw it in the trash. I'm now going to throw this in the trash as well. If this were a male, I would start from the urinary meatus and go down to the head of the penis, cleaning that with each swab as well. I'm now going to bunch up the catheter in my hand and take it off with this hand, and I'm going to begin to insert the catheter into the urinary tract. I would go until I received urine, and then I would go just a little bit farther. For a female, this would be about 2 to 3 inches. For a male, it would be about 8 inches. So once it is in, I'm going to hold it and insert the fluid into my balloon. I would then let go, and this is not a sterile area anymore. It does not need to be a sterile area anymore, and I would detach that. With the balloon inflated, I would give it a small tug to make sure that the balloon does not go anywhere and that it is inserted correctly inside the urinary tract. I would then attach this to the thigh of the patient to make sure, with some give, to make sure that it does not get pulled. I would then put the bag below the bladder length of the patient and attach it securely onto the bed, but to a point of the bed that does not move if the bed moves. Then I would clean up my area and throw away all the unnecessary and unused items. If I was giving care to a male, I would use this and lay it on lay it across around the penis, that way I could provide my care. I would then throw away all of my trash, take off my gloves, and wash my hands. I would document the type of catheter used, the size of the catheter used, how much fluid was put into the balloon. I would document the date and the time, how the patient tolerated it. If there was any pain, I would document the urine color, the urine clarity, and the amount in urine that came out when initially. I would then remove my gloves and wash my hands. I'm now going to be removing our patient's catheter. So I would walk in, introduce myself, wash my hands, verify my patient, verify the order, and put on clean gloves. I would then empty our bag and remove it. I would bring in a hazardous bag and my 10 to 12 milliliter syringe. So after emptying our bag, I would discard it and I would put it inside my hazardous bag. So then I'm going to double check how much fluid was inserted into the balloon so I would know how much I would need to take out. So I'm going to insert this into our balloon section, and it should start to relieve itself by itself, but you're still going to pull it out to the correct amount. Take that out. And now I'm going to ask my patient to take a deep breath, and as I exhale, I'm going to pull it out. Okay. And you're going to want to pinch it so no urine is dribbled anywhere in the area. And then I would place this in our hazardous bag. I'm now going to provide some peri-care and clean the area. And then again, I would wash my hands, remove my gloves, take our hazardous bag to the correct position and area. I would replace the patient with their legs down, ask them if they're comfortable. I would document how the patient tolerated it and that we removed the catheter without any complications.